I came into the realization of what my disease was, and it is a disease. I'm basically allergic to alcohol.
I was what they call a functional addict. So when you're a functional addict, you are this person who lives a double life. So you are able to prioritize certain things, but however, your life is always organized around the substance.
I thought I have to change. Ngilungise impilo yami, ngibe nempilo engcono ngoba ukubhema kungenza stress more because ngiluze almost izinye izinto bese ngizamile empilweni.
The longer I am in this program, it really just the easier it gets, because it becomes a habit. It becomes a habit of not drinking. It becomes a habit of being a better person. It becomes a habit of not lying, cheating, stealing like I used to.
Alcohol and substance abuse continues to be a major global public health issue. South Africa is amongst the top 10 narcotics and alcohol abusers in the world. 80% of male youth deaths are alcohol-related, and drug consumption is estimated to be twice the world norm. At least 15% of South Africans have a drug problem. Now, the average age of experimentation in South Africa is 12 and decreasing, while the age of patients undergoing treatment ranges from 9 to about 82. Now, it's estimated that up to 60% of crimes committed involve the use of substances. Now, South Africa also has a rate of fetal alcohol syndrome, which is 5 times that of the United States. So today we discuss alcohol and substance abuse, and we'll be joined in studio by a clinical psychologist, Chief Director of Families and Social Crime from the National Department of Social Development, a non-alcoholic board member from Alcoholics Anonymous South Africa, Director of Sanka Srantra Rand, and a recovered drug addict who will share his story with us. Now, we invite you to be part of the show by asking the panel some questions or simply just sharing your view with us. And the number to call is Johannesburg 714-6918 or 6919. You can also tweet us at SABC Health Talk or simply interact with us on our Facebook page, SABC Health Talk. So sit back, relax, and learn from this bumper show coming to you just after a short break. I'm Dr. Solomon Taung, and this is Health Talk.
We're essentially talking about a condition where your body has a difficulty utilizing glucose effectively, so it starts building up in the bloodstream.
It's important to understand that one cannot cure diabetes, but you can manage it.
The best advice I can give is understand and know your diabetes.
About 70 to 80% of women will suffer uterine fibroids by the time they reach the age of 50.
There are a lot of women walking around who don't even know that they've got fibroids.
Join us on Health Talk, Saturdays at 9 a.m.
To be a part of something like this makes me proud, and I think that to be able to report the news in a fair, just, independent and impartial way is what the public broadcaster stands for.
He started drinking at the age of 25. Not knowing that one day he will be addicted to alcohol. He tells us how he got addicted, and he will remain anonymous due to the AA policy.
I drank, I suppose, normally for the first couple of years, and then something what happened is that I crossed a certain line, which they call the invisible line, and where alcohol was just a pastime, it became a necessity for me to drink.
His health was affected due to everyday drinking.
My health was very bad. My skin color was bad, my tone was bad, my liver was extremely bad, it was swollen. I think my emotional health was very, very, very bad, worst of all, to the point where I started contemplating to commit suicide.
Contemplating to take his own life was a wake-up call for him. He then realized that he needs help.
I realized I had a problem when I was not drinking. I was making a nuisance of myself in my family life. I was making a nuisance of myself in work life and in social life. I was hurting emotionally people. I was really destroying friendships and people around me.
The first term to his recovery was difficult, as he didn't understand what AA was all about.
I didn't understand what they were saying, and I found it difficult to follow. I thought it was a movement or a religion, and it's none of that. It's just people of a like-minded problem wanting to help other people with a problem.
He got immense support from friends, family, and mostly his wife, who works at AA.
You must be supported, but you mustn't be babied. This is a program that you must do for yourself. And I was very, very fortunate that my children, my extended family, my brothers and sisters, and my wife, and most of all my wife, supported me 100%.
To understand how AA works, you will need to go to some AA meetings and meet people like yourself who had a problem with alcohol and are now recovering.
All right, so obviously that was about alcohol, but today we're talking about alcohol and substance abuse in general. We're going to learn more from that. Let me introduce our special guest for today. First up is Thabang Tlaka. Thabang is a clinical psychologist in private practice out in Pretoria. Welcome to Health Talk, Thabang.
Thank you very much.
All right. And then, of course, in the middle, we have Roshni Nadisan. We've heard a lot about Alcoholics Anonymous. She's the non-alcoholic board member from Alcoholics Anonymous South Africa. Welcome to Health Talk, Roshni. All right. And last but not least, we have Terence Makananisa. Terence is director of Sanka Central Rand. Welcome to Health Talk, Terence.
Thank you, Doc.
Right. So perhaps let's start with the basics. Let's try and, obviously, people would want to know about Alcoholics Anonymous and so on, and that's why you're here, and Sanka and so on. But let's start by defining some of these basic terms. Yeah. I mean, we know of people using alcohol. Let's use alcohol as an example. Yeah. Using, misusing, abuse, addiction. Can you just take us through that, spectrum of...
Yes, I think it's a good place to start. I mean, so maybe we can start with what is a drug.
Yeah.
And a drug would be just a chemical substance that alters. It can be natural, it can be artificial, it can be legal or illegal, that alters the functioning of the body. When we're talking about then substances are those that then get abused. So prone to be used a lot more, your alcohol, over-the-counter drugs and things like that. And when it comes to dependence, we are talking about a maladaptive pattern that a person has. So you are using these drugs in a way that is not good for you, and it's characterized by your body responds to, it gets used to a certain amount, then you probably need more to cope with it. If you don't use it, then you have withdrawal symptoms, and it's something that you think about all the time, and it starts becoming you're abusing when you're using it consistently, and you're using a lot more consistently, so you struggle to not just use the substance, but you need it more often and often, and generally then it interferes with your...
So there's a fine line then between abuse and addiction, or could it be the same? Or some overlap?
Yes, so there's a fine line. So when you're addicted, I mean, so there's on a psychological element, so psychologically you need it, and physically you need it. So that's when you're addicted, and when you're abusing, you are using it more than you should, and you're using it more consistently.
Talk about substances. Perhaps, I know you're going to be talking largely about alcohol, but let's talk about, the most commonly abused substances. Yeah?
Well, that's the concern that we have. Alcohol is one of the very abused substances. So you have this broad spectrum of drugs, and your drugs have a range, as Thabang has said. So we would talk about your cocaine, and heroin and crack and all of the derivatives. I think there's been a lot in the news recently about the different types of drugs because of the legal implications. The cannabis that has been legalized for private use as well. Right. But in this whole notable increase has created a lot of concern because of the negative outcomes.
Well, talk about increase. I mean, I quoted some statistics in the beginning. How prevalent is this problem, or what is the incidence? Tell us.
It's bad out there. Yeah. That's how I will, start, with it. in our stats that we have actually collected until March 2018, which is our financial year, end of financial year, we have recorded that alcohol, obviously, and marijuana, it's the mostly widely used drugs.
Yeah.
But these days, people are not only just using those substances in in isolation. In the a few years ago, a person would be an alcoholic, would be a drug addict, not necessarily an alcoholic. But these days we find, the dual, users, as well, the poly, dependent, people as well. So they are not only using 2 drugs, they're even using, more, than one, drug. How we normally collect our stats is that, we will ask, a question that says, what is your preferred, substance?
Yeah.
Obviously, they will give us, the substance that actually brought them to our centers. You understand what I mean? So one of it would be that they are there for marijuana. But as you do drug testing, then you will find that they are actually using more than, one substance,
Okay.
So when we find, that your marijuana at this particular moment, as well as alcohol, it's the widely, used, drug.
And who abuses these? I mean, I quoted, a wide range of, people that are undergoing treatment ranging from 9 to 82.
Yes.
Who are these people in there? Anyway.
Yeah.
So we've actually found that there is no age distinction, although there's prevalence in some of the ages. If we go back to the statistics that you've mentioned, in terms of alcoholism, we found that South Africa has the highest fetal alcohol syndrome in the world. 2 towns in DR, and one in DR, one in Western Cape, have the highest fetal alcohol syndrome. And that obviously then points to the users, and here we're looking at mothers that are using alcohol. We've also found women in Africa. We found 1 in 3 women have been found to be abusing alcohol. So, and we found there's also a high statistic amongst the youth, the younger youth, right through. When you go to primary schools, we found 10-year-olds being addicted to alcohol and to drugs.
And so there are also, I suppose, distinctions depending. So talking about perhaps provinces, so a certain province will have a prominent, I suppose, addiction. Men in general have a problem, and younger men. But you see between men and women, you see that there's a more prevalent with men using these substances.
Okay. So I suppose for people watching this program would say, so how do you see that someone is having a problem of alcohol or drug abuse? Are there telltale signs that, kind of warn you?
Yes, I mean, so when somebody actually has an addiction, we normally think it's just affecting them, but usually there are 3 or 4 other people who will actually notice it. So parents, family members, and children. So they'll notice things like, so in a family, the family, because it's a system, everybody will notice that there is a problem. So you'll notice when somebody's life changes, they're not, I suppose, functioning the way they're supposed to, they're not performing well at work. There's sometimes a lot of denial. Relationships are also affected. Sometimes there are issues with money. So there used to be a certain pattern, but it's sort of changing for most people, unless you're dealing with somebody who's got who we can say they're a functional addict. But you'll see those changes in that people start denying. It's affecting their work. It's affecting their relationships. There are issues with money. And when you talk about it, people get sometimes defensive, sometimes irritability. And so when you see those kind of pattern, one needs to just have a closer look at what's happening.
I suppose, Vareshni, you see that a lot more than in alcoholics.
That's right, yes. I am a social worker as well, so we've seen this trend. So you look at the patterns that take place, as Thabang says. So you would have sometimes those that experiment, or your debutants, basically, those that debut into alcohol and drugs. You would also have your social drinkers, or your social users, and that would normally take place or occur at events, or even at home. So people would drug or drink at home, and that's an extremely dangerous phenomenon that we picked up. But then you also have your harmful drinking and your hazardous drinking. And that's where it impacts on the community. You and I, as drivers and pedestrians on the road, are placed at risk because of drunk drivers.
Talk about risk. I think that it's a good place to go for a quick commercial break. When we come back, we're going to be looking at some of the risk factors, but more impact of abuse of substances. Please stay with us.
The great bank heist.
It was brazen. It was quick.
One thought we're perhaps looking at figures much, much lower. Right. It's almost 2 billion.
It was shared amongst very greedy VBS executives and politically connected individuals. You are listed in that report. Did you steal money?
The narrative that they're trying to create is proven wrong by Advocate Mtao's report himself. He said in point 59 that he could not find a definitive wrongdoing, anything factually.
The misleading information which Daily Maverick has is deliberate. It's part of the whole propaganda machinery. You can challenge this poly Fanville to bring us the so-called evidence that I received 10 million. It's pure insanity.
Is there any prospect whatsoever of saving VBS?
We are not as confident as we were when we started the curatorship as to restoring the bank.
The bank is in a hopeless situation and it cannot be saved.
Fashion, travel, music, food, and food. Did I mention food? We at Trends Travel love bringing you cuisines from around the world.
Forbes US have declared Maboneng the coolest city destination to visit in the world for 2018-2019.
You know, as designers, we're always setting trends and also doing like high fashion. So it was quite nice to come and see the ready-to-wears every day.
At like age of 12, so my first smoke was not cigarettes. My first smoke was tacha.
Fast forward a few months later, he started baking and selling what they call space cookies. Little did he know that he will get addicted.
That's how I actually got into the tacha, because now you must purchase the tacha so that you can bake the space cookies. So whatever tacha is left, then you smoke. Then that's how I got hooked.
After realizing that he is now addicted to tacha, Temba tried to quit. Unfortunately, he only substituted one substance with another.
As a substitute was the alcohol. Yeah, and in my family we do have a serious alcoholism problem. My sisters, my brothers, even my dad at some stage, he used to be an alcoholic. So alcohol became the thing.
Temba and his friends used to binge drink. This led to him developing health problems and ending up in hospital.
There was a point where I drank so much that I slept. So at home I stayed in the back room. So I slept for about 2-3 days. So my family were very concerned. So they took me to the hospital. The hospital, they said I had alcohol intoxication. So I was admitted for the alcohol intoxication.
Temba finally got professional help at the Westview Clinic in Roodepoort. He got tired of putting his mother into depression.
My major thing was family interpersonal conflicts. So because my mother had been dealing with my brother, my father, and my brothers and my sisters. My sisters are on alcohol, my brothers are on nyaupe. So my mother had so much stress. So it always it ended up creating within myself subconsciously a shame-driven kind of attitude. So every time now I use the nyaupe, there comes these feelings of guilt, these feelings of shame.
We met another patient at Westview Clinic, Banele. She shared with us how she got addicted to a substance called nyaupe.
I wasn't sure ukuthi ngisebenzisa inyaupe because bengibhema intsango. So inyaupe like labantu bengibhema nabo intsango, so yibo bebabhema inyaupe bagcine sebabhema inyaupe. So mangilokhu ngiyakubo ngiba attenda ngithi bangibhemise like because I used to usually bengispend isikhathi sami nabafana. So ngilokhu ngibhema ke ngifike ngithi bangibhemise bangangitsheli ukuthi sibhema inyawupe manje sisabhema insangu.
After finding out she was given nyaupe, Banele didn't stop taking it due to her stressful situation at home.
Because ukuthi ngiqhubeke ngibheme, it was because of ukuthi ngibengifila ngazuthi iyo bengikhipha i-stress more because ngikhule ngi-abuse and then nale relationship yami nasekhaya nogogo bengekho right.
She advised those that are experimenting to stop while they can, as nyaupe is in child's play, according to her.
Asinto ngadlalela kuyo njoba ngisho ukuthi mina ngize ngayiphi igama ukuthi it's a demon, iyi-demon. So asinto ngadlalela kuyo. Njengamanje you can see I'm 35 but I look maybe 19 or 20. So I lost almost ne life yami, ngibuya nasesibhedlela twice because of yona nyaupe.
So these drugs obviously can have terrible impacts on one's all aspects of life in general. Well, to tell us a little bit more about that, we still have our guest, Thabang Tlaka, a clinical psychologist, and we're now joined on the extreme left by Caesar Magangwe. Caesar is the Chief Director of Families and Social Crime from the National Department of Social Development. Welcome to Health Talk, Caesar.
Thank you.
All right. And in the middle, we have Mandla Mbata. Now, Mandla is a recovered drug addict who's going to share his story with us. Welcome to Health Talk,
Thank
Mandla.
you so much for having me.
Perhaps let's start with you, Mandla. Tell us your story. You say it's correct to refer to you as a recovered drug addict.
Yes.
Right. Just tell us your story. Where did it begin?
Okay. Firstly, I would like to say thank you very much for having me on the show. You know, I was told, as a recovering addict myself, I was told that the only way I could keep what I have is by giving it away.
Right.
And in terms of passing on the message of hope to other still suffering addicts.
Right.
Now, with me, it all started, you know, there's a saying that goes, never underestimate small beginnings.
Yeah.
With me, it all started with, you know, with boys, naughty boys, having to play around with cigarettes, butts.
Yeah.
You know, and little did I know that that was my initiation, or rather a gateway to hell, if I may put it. So it all started with those small beginnings, you know, and I started experimenting with cigarettes.
Yeah.
And
How old were you then?
I was 12 years old, because I remember I was still doing Standard 5. It was Standard 5 at the time.
Right.
So it went on. I remember when I started attending in high school, I started using dacha. You know, and it's only now that I realized that I feel like I had this addictive personality. Because some of the guys I started with, they just quit, you know. But for me, I love the feeling I got from the cigarettes. I love the feeling I got from dacha. So for me, dacha was not really a problem. You know, I was the problem, because I love the effect that I got from dacha. It went on. I remember when I was in Standard 7, I was introduced to Mandrax, you know, and from there on, I started experimenting with heroin, which is in nyaupe. You know, and wow, like I said, that was hell on earth. You know, and funny enough, as much as it did great harm, not only to me, but also to my parents, because I've learned that for every one addict, about 16 people get to be affected. You know, like my parents said, it's my family, my mother, and the community at large. You know, and
So what then happened? So you experimented and got addicted to all of these substances that you mentioned.
Right.
What about alcohol, by the way?
Between the years, I was also using alcohol, because, you know, it's acceptable to the society. You know, so I never knew that I was basically I'm a recovering addict and an alcoholic. Because you see, with me, you will never make a normal drinker out of an addict. That's highly impossible. We don't know how to drink alcohol like normal people do. The lady spoke about 3 types of people. We have a social drinker, we have a drunkard, and we have an alcoholic.
Yeah.
You know, and she went on to emphasize to say social drinker is somebody who would drink socially, you know, Christmas parties, his or her parties. Yeah. Then you find a drunkard, somebody who use alcohol for Monday to Friday. He does his responsibilities, but come weekend, he would drink, but he remembers Sunday, which is normal. After 12, I have to drink water because I'm going back to work. Then you find an alcoholic, whereby everything revolves around alcohol. I live to drink and drink to live. You know, same as drugs. You know, and there was a point in my life where I substituted my drug of choice with alcohol. Because remember, I love to be intoxicated.
Yeah.
Like I've said, drugs and alcohol are not really a problem.
Yeah.
I'm using them. They're not using me.
I realize that you said you're a recovering,
right,
as opposed to a recovered addict.
Right.
What is the difference?
You see, addiction and alcoholism, it's a chronic disease.
Yeah.
That's my personal view. It doesn't have a cure, because there is nowhere you could go to maybe a doctor and ask for medication that will keep you from having other cravings.
Right.
So I'm a recovering addict because of this is a daily reprieve. It's something I work on daily.
Okay.
And
so when was the last time you used any of these?
I'm 4 years, 7 months clean now.
How have you managed to stay clean?
One of the things is I work a 12-step program. I surround myself with positive people, and of course not forgetting where I come from in terms of using. So one of the basic things that have helped me is, one, to be honest with myself, that I'm powerless over drugs and alcohol, and obviously that my life had become unmanageable.
Okay.
And I was taught that I had to find a power greater than myself, because you understand, drugs and alcohol had become a power more powerful than me. So I had to find a power that is more powerful than drugs and alcohol, and that was the goal of my own understanding.
All right, so let's take Anonymous on the line from Limpopo. Anonymous, welcome. Anonymous there? Okay, we'll come back to Anonymous. But let's come back to you, Caesar. I mean, we've had the story from Mandla. From the department's perspective, perhaps before we ask for your perspective, just tell us a little bit about your director of chief director of families and social crime, and how is that structured, and what exactly do you do?
Okay, I'm responsible for 4 portfolios. The first one is families. We work around strengthening families and support them in many ways. For instance, the issue of substance abuse also impact on families. So therefore, families needs to be strengthened, because for you to be able to support a person that is using substances, you need to have some kind of skills, because you might think that you are helping, whereas you are doing more damage. So we work around that. I'm also responsible for a portfolio that deals with victim empowerment, which is conflict, gender-based violence. It's also contributing to they are linked to substance abuse. The other one is social crime, which is a youth in conflict with the law. Obviously, people that are using substances, they end up committing crime because of they want to maintain their habit, or you drink and drive, you end up in jail. So it is linked. The last one is the one that brought me here, which is anti-substance abuse program.
Okay.
I am
tell us about that then. Are there policies, perhaps programs that you put in place?
What we do as government, we are responsible to develop or establish legislations and policies to create an enabling environment for various partners to partake, because this issue does not only affect one department, it affects so many departments. Therefore, it is important that we have policies that are supporting programs. So we do that. The second thing that we also do is also to come up with norms and standards, because this scourge of substances has created an opportunity of mushrooming of treatment centers. We see so many treatment centers which are not really up to standard. So therefore, we come up with treatment standards to say whatever the program that you're coming up with, one, it has to be evidence-based. We must know that it's working. There must be a logic behind it, or a research that really backs that intervention that you're coming up with. We're also looking at we must make sure that the program that you are rendering, it's a multi-approach program, meaning that not only one person, the psychologist must be involved, social work must be involved, doctors must be involved, pastors must be involved, various stakeholders must be involved, because they all have a role to play in a treatment program of a particular individual.
Right.
We're also looking at the last point, just to say that families are quite critical, because they play a role of being enabler in a negative way.
Right.
Like maybe if I'm using substances, my family will be calling at work and say, I am not well, giving excuses while they are enabling me to continue drugging in one way.
We're going to come back to that issue of family, because I think when we start talking prevention and treatment, I think it's quite important. I believe Anonymous is back on the line. Anonymous, are you there?
Yeah, the get to anymore.
Okay. Your comment or question, Data?
nna ke na le bothata mme ke a re ke lebeletse lenanele bothata ba ka ke motho e le gore ke amputated ka baka la bolwetse wa re ke PVD ke motho e le gore ke berekisa marijuana go feta trekang jale ne ke opela thuso ba lona no ke feletse ke mmereko a ke na le otlo ka baka la utsuwa marijuana ke mo hae jale ne ke opela thuso ra ona mo nka kry-a thuso ya gore nka kry-a thuso ya gore ke tloele utsuwa marijuana ba re ba mpoditse gore ke tloele mara ke a palelwa le ona no ene ba mpotsa gore a nka tswela pele ke ba ta amputate leoto la bobedi.
All right. Thank you, Anonymous. We're going to try and help you just for the benefit of everybody else. Anonymous basically says that he has a huge problem. He is addicted to marijuana, and as a result, he's had health issues. He's had his leg amputated, he's unemployed, and is really in need of desperate help. He desperately needs help, and we're going to share some numbers or even websites where they can get help. Let's come back to you, Tabang. We were talking earlier about the issue of risks. What are the risk factors for abusing substances and drugs in general?
Yes, because it's a broad thing. So one of the things you have to think about is there are biological reasons why people abuse. So it can be a genetic thing that you got it through your parents. So some people will smoke, but when you do it or when you drink, it's worse for you. Other issues could be perhaps the way you were raised or how you think. So psychological issues that affect you, or societal issues where. Depending on the community you are in, the friends you are in, because abusers also tend to do that. You separate the people who tend to help you, and then you associate with people who perhaps enable or make it worse. Also, just being in a context where there's a prevalence of use, when one struggles to deal with conflict properly, that you can't resolve your own problems, and sometimes deep unresolved issues that one might not necessarily be aware of. So when those things are happening, so we can see how one is at risk, and that might need some attention.
Right. Obviously, this is quite a wide subject. Yeah. Before I let you go, Mandla, and by the way, thank you so much for being this brave and be willing to share your story with us. Just in the last 30 seconds, your final message to people out there who might be thinking of using or experimenting with substances, and to those that are struggling currently.
I just want to let them know that there is help. Right. It first starts with one being honest with themselves. If they truly want to, get help. Yeah. You find organizations whereby, like Abu Sanka, where you can go and ask for help. And most importantly, there are people around our community who are more than willing to help. Sometimes the neighbors or Konalosi Somazi or somebody you can talk to, because it all starts by talking to someone. Yeah, and most of all, the therapeutic value of one addict talking to another. Because I've realized that most of the community members don't really understand us. They think we're sick, we have a demon. You understand? And they have this obscure way of looking at addiction.
Manzambata, thank you so much for sharing your story. Time for another quick break. When we come back, we'll continue our discussion on alcohol and substance abuse. Please stay with us.
Life can throw all sorts of surprises at you, often when you least expect it.
Sorry, Mom.
That's why it's important to have medical cover. Me? I didn't want just any medical scheme. I wanted a scheme that I could rely on, that I could talk to at any time, that I could afford. I didn't just get medical aid. I got medical paid.
Buildings, submerged homes and devastated families.
Biggest earthquake in here.
Their homes and buildings moved like boats.
Big shake, and I ran as fast as I can.
These are the satellite images depicting the area before the disaster.
The ground is like a wave.
I've never seen anything like this in my life.
It is unbelievable. You can actually smell the stench of dead bodies around.
The National Hurricane Center said earlier on Tuesday that Michael was a Category 1 storm with sustained winds of up to 150 kilometers per hour. Residents were implored to get out of harm's way ahead of life-threatening waves, winds and rains. Flash flooding over the weekend caused 13 deaths in Central America after Michael formed off the coast of northern Honduras.
This is a space for every woman in South Africa.
I want to speak to the women who cannot walk a kilometer in this country without looking over their shoulders, without being groped or harassed.
I was not born like this. In 2011, I got stabbed by a boyfriend.
How many centimeters? How many centimeters long is the political will to end the scourge of violence against women, against children?
I was locked up in the room for 2 weeks.
There are measures, there are laws, there are policies. But these policies and measures and laws do not speak to these lived realities.
We must fight the culture of gender-based violence.
This is where young men must be taught that women are not their footballs. This is where young men must be taught to respect women.
Okay, welcome back. We're talking alcohol and substance abuse with our guests. We have Thabang Tlaka, a clinical psychologist, Veroshni Nadisan from Alcoholics Anonymous, and of course Caesar Makangwe from the National Department of Social Development. Before we start this, we have another caller on the line from Limpopo, Joyce. Joyce, welcome.
Hey, Likai.
Mara
kimsonga kwasithanga mara kikozama ka Spade.
Zama ka Spade sema.
Hey, let's arking today to tell you this how we akere yabo nyabope. Itlo to savana banchi.
Right.
And nkari bona bo ba psychology nka ba ka ko skolong. Bo di sa skolong uri. Bana banchi ba tshwa di nyabope ko toilet.
Right.
Ya bona.
Yes.
And re a debo ka mata uri.
Thank you.
Abarutisivana.
Thank
and then le morathuaka wa tsuba
yeah
nyabope nke wa ruta le yena wa bona mo TV
yeah
ke a lebo
thank you
zama ke mchangala mtonga
thank you so much you've done very well thank you so much Joyce from Limpopo basically saying that she's appreciative of what we're doing, you know, having programs like these, and is extending an invitation to the psychologists to go out to schools, because in schools particularly there's problems of youngsters trying out these drugs, especially nyaope, and yeah, there's a challenge for you guys to...
Yeah, because it is a problem, and I think the sooner we intervene in families at school, I think that would be, right. I think that's one thing that would help.
Okay, this fits in nicely into what we're discussing now, because it's prevention, and we're gonna come back to the issue of awareness and so on. But let's just finish off our discussion on risk factors, because, you know, before you can know how to prevent something, you need to address the risks, or at least know what the risks are. Roshni?
So there's various risk factors. Now, when you talk alcoholism, for instance, you know, one cannot distinguish whether it's an age factor or even a professional factor, or whether a person is down and out, unemployment. Those are all contributory factors, but it's not the factor. So the risks would be what you have noticed in terms of binge drinking, in terms of whether the person does not go to work the next day or fails to wake up the next morning because of the night before, or maybe gets up in the morning and needs to have, you know, something to help.
So let's stay there on binge drinking then. Yes. How do we prevent that? It's kind of difficult sometimes. So what practical steps can people take to avoid this?
Well, you know, I think as soon as they recognize, or even around, if people can recognize, Thabang's mentioned that 3 people around them would have recognized it, but in AA we believe that at least 16 people have been affected by one person's drinking. So people around you would have raised this, and there's lots of denial. People go through denial as a natural process. But eventually, when they do enter the doors, for instance, of Alcoholics Anonymous, you don't have to, you don't even have to declare anything. You welcome, as long as you are committed to or have a desire to give up drinking.
Okay, let's stay with Alcoholics Anonymous, because I'm interested in finding out what exactly Alcoholics Anonymous does in both prevention and assisting those that are addicted or that are alcoholics. Yeah?
So,
and by the way, sorry, we say you're a non-alcoholic board member. Please explain that concept.
Okay, I will bring that in as well.
Yeah.
So AA, Alcoholics Anonymous, is a fellowship of men and women who have recognized that they have a problem with alcohol and they have a desire to overcome this. As our speaker spoke about recovering and recovered and being an alcoholic or a drug dependent, it's a process. You're one step away from your next drink of returning or relapsing. So as long as you have a desire for this, you're welcome to attend any AA meeting. In South Africa, AA has been here for about 75 plus years. We have more than 330 group meetings in the country, throughout the country, and it would be wonderful if our callers from Limpopo could attend those meetings. So from a prevention point of view, we've spoken about me being a non-alcoholic board member, and I'm basically a community member.
Okay, just there. Let's quickly take Audrey on the line from Pretoria, I think it is. Aubrey? Are you there?
Yeah, my point is, we've got people whom we regard them as cornerstone of our society. Like, for instance, teachers, doctors, social workers, pastors, you name them. Lawyers, advocates, magistrates. But at the end of the day, those are the people who are demonstrating substance abuse on a daily basis. For instance, at schools, the principal knows that there is a teacher who has this problem, but they are unable to discipline a teacher or move a teacher from the system. Then at the end of the day, when you've got a problem, the very same teacher is the one who says, oh, these people or this student is suffering from substance abuse. The very same teachers are having the same problem. Like for instance, with pastors. The pastors who are doing horrendous things. But people who are told every day that you need to go get counseling from a teacher.
All right,
and social workers do those things. And even though you need to go to social workers to get help with this problem.
Aubrey, I want you to thank you so much for your contribution. Unfortunately, we're running out of time, but you're making very, very valid points there. Let me try and get a comment from the National Department of Social Development. We're talking prevention from policy perspective, and just expand a bit on what's done,
Okay, as much as I want to address prevention, I still want to go back to the issue of risk because it links with the prevention.
Absolutely.
The first other risk, my colleagues have already mentioned some of them, but the other ones that I think are also important is the issue of mushrooming of shebins and taverns. It is a challenge because it puts people at risk. It makes alcohol easily accessible, and therefore it contributes to the scourge of substance abuse. The second one is the alcohol in South Africa is very cheap. The fact that it's cheap, it makes people to be more, it's accessible because of it's cheap, as well as the emerging drugs, which is bonyaupe, and it's easy to mix them and it becomes cheap. The last one is the culture of drinking. We need to confront the issue of culture of drinking in South Africa. When we mourn, we drink. When we celebrate, we drink. And for those things, for as long as we have not confronted or contend with those, prevention will become a challenge. For instance, if you look at the schools, the matrics, when they finish writing, what do? They seal that with drinking. So culture of drinking is a challenge. So our prevention programs need to tackle our conduct and our behavior.
Okay. Our time is up, but I'm going to give you 30 seconds. Last word from Alcoholics Anonymous in 30 seconds.
Alcoholics Anonymous believes that alcoholism is an illness. It's a progressive illness. It's similar to having an allergy. So you take one and you get back to, you relapse totally. So when you enter the doors of Alcoholics Anonymous, You have people that would support you. You don't have to fill out any forms. You don't even pay a single cent. You have people that would sponsor you through the program and take you through the 12 steps.
We're going to share the telephone numbers just in case anybody would like to get in touch with you. But unfortunately, that's all the time we have. Thank you so much.
Thank you.
Okay, time for another quick break. When we come back, we wrap up our discussion on alcohol and substance abuse. Please stay with us.
This is a space for every woman in South Africa.
I want to speak to the women who cannot walk a kilometer in this country without looking over their shoulders, without being groped or harassed.
I was not born like this. In 2011, I got stabbed by a boyfriend.
How many centimeters? How many centimeters long is the political will to end the scourge of violence against women, against children?
I was locked up in the room for 2 weeks.
There are measures, there are laws, there are policies. But these policies and measures and laws do not speak to these lived realities.
We must fight the culture of gender-based violence.
This is where young men must be taught that women are not their footballs. This is where young men must be taught to respect women.
Okay, thank you so much for staying with us and welcome back. We're talking substance and alcohol abuse with our guests, Thabang Tlaka, clinical psychologist, Caesar Makangwe, Chief Director of Families and Social Crime, and we're joined back by Terence Makananisa, who's the Director of SANCA, Central Rand. Perhaps let's stay with you a little bit, Terence. We haven't heard a lot about what SANCA does. Just tell us about what SANCA.
SANCA is an older organization. Yeah. We are around for about 60 years and more. Yeah. We do a lot of treatment and rehabilitation services. Right. We're also doing a lot of prevention work. One was talking about the schools and all those type of things.
Just briefly about prevention, what do you do there?
We have prevention programs like we working together with the Department of Social Development in one program. We call it Kimoja. It's mostly based it's an outcome based prevention program. What we normally do is that we assess the level of knowledge of children, and then we will then teach them about substance abuse. Then we will do what we call a post-test, just to see if we have made an impact on whatever program that we actually have implemented. But we do a lot of awareness campaigns also in communities, just to give people information about substances, as well, the different types of them, what it does to their body, and all those type of stories, and where they can actually get help if they feel that they're at a stage where they now need assistance.
Okay, so Thabang, let's talk principles around treatment now. And I'd imagine it's not a simple thing like you go over the counter, get a tablet, and your problem is gone.
No, it's not. And earlier you touched on the idea of one that is recovering, So if you're recovering, treatment will have to involve some sort of biological component. So sometimes when you're addicted, your body's used to the substance, so a doctor is needed. They were talking about a multidisciplinary team earlier, so you might then need to see a doctor. You might then, there's a spiritual element to it that you need to look at, and a psychological element to it, because sometimes you rationalize your behavior, your family is also enabling, your friends are also enabling, so that also needs attention. And for one to find a structure really grounds a person. When a person does not have something to do, somewhere to go, to just plan their day, to measure themselves, when a person doesn't have that, they struggle to treat that, to work with their issue. And to always know that if you have a special relationship with the substance, that's something that one will always have to work on. The guest mentioned earlier that, if you have a special relationship with alcohol, you can't just drink like everyone else. Right. So those components would be needed.
Okay, let's take Anonymous. We have lots of Anonymous here. Anonymous from Pretoria. Anonymous, welcome.
Hello, how are you?
We're good. How are you, Anonymous?
Yes. Firstly, I want to thank you guys for the topic.
Thank you.
Hello?
Yes, we're listening.
Yes, I want to encourage the recovering addict, because I'm also a recovering addict.
Right.
I want to encourage them that they must attend the NA meetings and the AA meetings so that they can able to be clean for the rest of their life. Because we are suffering from a disease that there is no cure, but us.
Okay, unfortunately we've lost, but thank you so much for Anonymous. You're making very, very valid points there. Let's come back to the Department of Social Development. How well are we doing in terms of treatment? I mean, are we saying that we're making progress, or is the problem getting a lot bigger than our ability to solve it?
Yeah, we are making progress, because when we started with this program, we only had about 7 public treatment centers. By public, I mean it's owned by state, you don't pay. And we also subsidize quite a number of private treatment centers in areas where we don't have, or in provinces where we don't have the treatment centers. So now we've got more, plus minus, more than 10 public treatment centers. We also subsidize community-based treatment centers, because the issue of the treatment is not only inpatient, it can be both inpatient or outpatient, depending on the assessment when they are doing it, to say which one is more applicable to your assessment. So there's quite a lot that we are doing, like I said earlier, which is the issue, the question that you are asking me, it's linked to the principles of treatment. To say what type, we are more looking at what type of a treatment program are we having, because programs needs to be accredited to protect people, because people can die. I'm sure you have seen it where a person has gone through a treatment program and he ended up dying. So we look at those things to say what type of a detox is this person, a detox regime is he exposed to, what type of a treatment program do we have, is it a program that is written down, there's a model that is behind that. So we are trying to do our best under the circumstances, because one of the challenges that we have is the funding. We don't have adequate funding to actually, provide treatment the way we would want to. So therefore, it becomes expensive to actually, support this work, and therefore that's why we were saying we should rather rely more on prevention. It's better to prevent than to say we'll treat, because like the guesses have already said, it's a relapse illness. So a person can be treated today for 100,000. There's no guarantee that that person will remain clean. Tomorrow the person will relapse
you
again.
mentioned 100,000. I mean, the issue of access to treatment and the cost, Terence.
Yeah, well, fortunately, like my colleague here from the Department of Social Development has, actually said, that, previously there used to be a lot of problems with access. But at this particular moment, I must say it, we as SANCA, we are also the beneficiary of, the support from the Department of Social Development. We have a number of, outpatient, treatment, centers across, the country, as well as the inpatient, facilities across, the country. And now recently, we have also have the, inpatient, center that was opened by the mayor of Johannesburg. In partnership with them, obviously, because the problem, it's getting, younger and younger. The younger children are actually using. So this is strictly for children, under the age of, 18. Believe you me, we have, the 10-year-olds that are on, inpatient, rehabilitation center as we speak at this particular, moment. So if we have to speak about access, there shouldn't be anyone, at this particular moment, especially in your urban areas like your, Gauteng and, your KwaZulu-Natal, Durban, and Cape Town, that must, say that they can't have access to treatment. And it really...
There is unfortunately so much to say,
yes,
so much to talk about, but so little time. Thank you to all of you for the contribution to Health Talk. Okay, folks, that's how, unfortunately, we come to the end of our show today. And, we're back on your screens in a week's time. And same place, same time. And until then, please do take care. Thank you, man.